Good morning and welcome to this new series of talks on digital transformation in healthcare. I'm Dr. Gigi Kurutukulam. I'm an interventional stroke neurologist. I'm also the medical director of Rajagiri Hospital in Kerala. In addition to this, I am deeply passionate about digital transformation and artificial intelligence tools that is in some way transforming the way healthcare is delivered. However, there has been quite a lot of confusion, lack of awareness, and last but not the least, resistance to change among healthcare professionals. This is a series of talks trying to create awareness about digital transformation and also to clarify doubts in this field, which I believe will help a long way in making this very important transformation in the field of healthcare. Let us start with the basics. What is the definition of digital health? It is essential to understand this definition because it helps to differentiate digital health from other overlapping fields, other terms which are loosely used. It allows us to track the technological trends more clearly. But why I am emphasizing this particular point is because of another reason. Digital transformation is essentially a cultural transformation. I repeat, a cultural transformation. It is not just a technology or technological transformation. Whenever we look at such a new technology or change that is happening in any field for that matter, we always have to look back and start from the historical perspective. Now let us take a quick look at how healthcare technologies evolved in the 80s and the 90s. 80s and 90s, we saw personal computers. It became sort of widespread, and we started seeing computers in the hospitals and in the healthcare field also. This is the time when the term e-health emerged. E for electronic. Hospitals began using computers to store medical data, taking printouts, reviewing data, enabling the development of what is called an electronic medical record. Now, then came the second phase with the computers started talking to each other or connected via the internet, and telemedicine was born. Telemedicine means sharing medical information remotely and even enabling basic forms of remote consultation where a doctor and a patient sitting remotely could interact and have some meaningful outcome without seeing face to face or near each other. Then came social media, leading to concepts like medicine 2.0, health 2.0. Patient gained access to peer support, other patients with similar problems. They could interact with people with similar illness, the patient support groups, patients with similar illness group. So they could share information, share experiences, gain insights. Patient could get second opinions. That means they could consult remotely with the doctors who are experienced in the field and get opinions from them. And health information once confined to what I would call something like an ivory tower of medicine. Previously, it was confined to hospitals and doctors alone. But with social media becoming popular and net, patients could gather this information, a lot of health information from other sources also. In 2007, with the launch of iPhone and other smartphones came what is called M-Health or mobile health. Text messaging, applications, various apps, wearable devices, all these began to connect patients and providers in a more dynamic way. For example, blood pressure could be monitored remotely. Heart rate could be monitored remotely using a mobile phone. The blood saturation, heart rate, temperature, many things could be monitored using wearable devices which are connected to a mobile device. And by early 2010, the speed of disruptive technologies entering healthcare becoming overwhelming, both patients and professionals. And that brings us to today, digital health, a fundamentally different kind of transition. It is totally different way of delivering healthcare. Now let us look at the traditional model of healthcare. What is a traditional model? Still which it's practiced in many places is a doctor sitting across a table and the patient sitting on the other side across the table, and the doctor looking at the computer in which he is accessing and looking at various medical health details of the patient. And here only the medical professional has access to the data. He only has interfaces available to him. This setup, the traditional setup, which I think even now many hospitals or institutions practice, there is a hierarchical structure in which the doctor is the sole authority and patient is a passive recipient of care. He is excluded from decision-making process. This model reinforces the idea of healthcare existing within a professional silo, or maybe we can even call it an ivory tower. This is the radical shift that is happening with the digital transformation of all health. If you look at the traditional consultation room, this is the digital health model that is seen. Both the doctor and the patient have access, but whereas in digital health, Both the patient and the doctor have access to the same data, interfaces, and technology. This model fosters an equal level partnership. It is not just about sharing data, it's about shared understanding and shared decision making. Digital health turns the patient from a passive recipient into an empowered patient. This shift marks a cultural transformation, a fundamental redefinition of roles, relationships, and responsibilities in healthcare. Digital transformation is more about a cultural transformation than a technological transformation. Let us try to define what is digital health. Let us have a deep dive into the definition of digital health. Digital health, I repeat again, is essentially a cultural transformation of how these disruptive newer technologies that provide digital and objective data are accessible to both caregivers and patients. This leads to an equal level doctor-patient relationship with shared decision making and democratization of healthcare. Now let us divide that into or break down into the essential three key components. Number one, it is a cultural transformation at the core. It is a cultural transformation of healthcare. Number two, it uses various technologies that provide data to both the patients and the medical professionals. And number three, it leads to an equal level partnership between them. Now, let us have a look at what is the impact of this proper definition. So, this definition is important. Having a clear definition of digital health helps us to differentiate between digital health and other fields like health informatics, telemedicine, wearable tech, etc. Understanding the purpose behind these emerging technologies, evaluate whether a new innovation truly contributes to shared access and decision making. I'll give you a simple test. Does the technology provide objective digital data to both the patient and the caregiver? If yes, it likely falls in the scope of digital health. Now, what is the road ahead towards democratized care? In short term, digital health creates shared decision making. In long term, it leads to democratization of care, where the patient becomes the true point of care. This is not just about apps or devices or wearables. The whole idea is about empowering patients, transforming mindsets, and building trust-based partnerships between doctor and patients. It's about making healthcare humane through the smart use of technology. Thank you for being a part of this introductory talk in digital health and digital health transformation. In the upcoming sessions, we will dive deeper into the various aspects of digital transformation in healthcare. If you have any queries or questions you would like to be addressed, please do let me know. I will try to address those in the upcoming sessions. Thank you once again, and see you next time with another episode.